thank you everyone for coming. Today it's our great pleasure to have Iain here to talk to us about the digital twin and the optimization technology applied for our Queensland Children's Hospital. Before Iain to start, I have prepared a couple of slides that will be approximately maybe 5 minutes as an introduction for our project and the background information for the energy assets at our Queensland Children's Hospital. So, okay, let's start the introduction first. We are a part of the AIRAH, Australian Renewable Energy Agency iHub project. That's for affordable heating and cooling innovation hub. We thank AIRAH and Queensland Children's Hospital and our partners to make this project come true. Next is, so yes, this webinar is recorded. Please email me if you're interested in having a copy. Please try mute and switch off video when the presentation is on. And please feel free to leave questions and comments via the Zoom and chat function. And we have 10 allocated as kind of a Q&A after the presentation. In the Q&A session, we welcome real-time questions and start a video if you can. So let's start talking about our iHub project background and introduction to our Queensland Children's Hospital. So iHub project aims to facilitate the heating, cooling, and ventilation, air conditioning, and refrigeration industry transition to a low emissions future, and stimulate jobs growth locally, Australia, and also showcase HVAC and R innovation in buildings. And this technology applied for us is at Queensland Children's Hospital as one part of the 6 living labs that we have. And we have partners in New South Wales and the ACT. That's with our partner at Uni Wollongong for the very good care, ACT schools, and education sector-wide activities. Locally, Queensland, we have Bolton Clark as a joining partner as well, working together to enable efficient operation, health, and environmental outcomes for aged care sector. That's another one for the sector-wide activities. So let's start talking about our QCH, Queensland Children's Hospital. It's the only children's hospital in Queensland, and it's not an old facility. It's just about 6-7 years old, a $1 billion asset. It has 19 floors and more than 100,000 meters squared. And there are 3 types of main HVAC: it's constant air volume, variable air volume, and active chilled bin for walls. That's 100% fresh air. And it has another building. So the previous one was for the children's hospital, the hospital building. And the second building here in the picture is a Center for Children's Health Research building. It's a 9-story building, 5 floors for the research labs, and other services, and also COVID testing area as well. Okay. The last one that I'm talking here is a central energy plant. What does it do? From name, we can tell that it provides energy, or maybe another way is, for example, chilled water plant. It has 6 chillers here. The one is a bit smaller one, and 5 big ones, more than 3 megawatts. And then cooling towers, hot water boilers, steamers, stormwater treatment, reuse, and also some standby power plants, generators, and also it has a grid connection to Energix substations. Before I hand over to Iain to start our main part, I think one thing is worth mentioning is that why Exergenics technology is selected for our testing at Queensland Children's Hospital. A few reasons. I'm only listing some key parts here. For example, Exergenics technology is a low-risk option. There's no need to access site because the technology is data-driven, and we worked on the historical data, and we tested it with the real data. And we also the technology works on the largest energy user for the health sector, as HVAC, and heating, ventilation, air conditioning. And also, as a matter of fact, HVAC often is the largest energy user, not just for healthcare, but also often for commercial, for universities as well, for example, education providers. And also that our Exergenics technology improves the chiller side operation without any impact on the air side. So no impact to the users at all. Later in Iain's presentation, you will see that some impact numbers, but here we feel that a significant impact can be achieved in a few different ways. For example, economical impact, environmental impact, operation maintenance, because balancing loads, for example, and also reduce peak demand. That can have a positive impact to our network connection. That's a good impact or interaction with the electrical network. So next one, I will hand over to Iain. And maybe let me introduce Iain first. Iain is the CEO of Exergenics and also co-founder of Exergenics, a Melbourne-based Australian company. Iain is passionate about, just 1 second, I bring up the brochure. So Iain, across his career, he worked as an energy engineer and a senior analyst at different companies or Climate Works Australia, and also is a guest lecturer at Monash University. And Iain has a master's degree in environmental engineering, and he has strong passion for improving energy system efficiency to drive climate outcome. And I think it's very important that our society leaders like Iain also, and he is contributing to our society in different way. Like Iain is a volunteer at St. Vincent de Paul and Superfund, and also he's a mentor to students of School of Engineering at the University of Melbourne. As a person working at the university, I personally, feel very grateful for the work you do at Uni Melbourne and also Monash University. Thank you. So, stop sharing.
Thanks, Darren. Yeah, thanks for that lovely introduction. I'll share my screen now, and thanks everyone for joining. Is that coming through?
Yep.
Looking okay? Cool.
Yep.
All right, perfect. Yeah, I guess first off, there's a few people to thank. iHub, Rena&AIRAH for their support in this project. The facilities management team at Queensland Children's Hospital have been great in they're providing the data, but most of all, Aaron from QUT, he's really driven this along from the QUT iHub side, and he's been great, fantastic to work with. So I appreciate everything you've done for us, Aaron, and great to see some results out, and looking forward to moving on from here. But yeah, I thought I'd just start with a bit of a brief introduction to Exergenics and what we do, and which building verticals we work in, and then jump into the Queensland Children's Hospital and a bit more specifics of the report that or the work that we've done there and the modelling we've done and some of the results of that. And it's presented in the form of our plant score report, which is the way that we're marketing this at the moment. So it's a report that will look at that historical data, as Aaron was saying, and develop control strategy recommendations based on how the system is performing, and pretty much the model looks for efficiencies that it can get within the system. But Exergenics has been around since mid-2019. We've been supported by a couple of accelerators, Energy Lab and Melbourne Accelerator Program. And we're also have recently just done the Brisbane PropTech pilot program that was run by the Brisbane Economic Development Agency. We've had a bit of support from CFC through their Clean Energy Seed Fund and Artesian, and have got a couple of innovation awards from Engineers Australia and the Green Building Council of Australia as well. And in terms of who we're working with, this is some of our major customers that aren't covered by NDAs. So we've been working with universities first off. We found they're really good as test beds and are open to new innovative ideas. And that's both on the air conditioning side for some of their buildings in the Caulfield and Clayton campuses for Monash, and at the Parkville campus for Melbourne University. And on top of the HVAC model, we've also got a refrigeration optimization model that works on rack refrigeration systems, common to most of the supermarkets you'd find. So we're working with Coles at the moment on 3 pilot stores, all Victorian based as well, and hoping to roll that out after the pilots go through. There's quite a lot more here that are all covered by NDAs, so these are the ones I can speak about. But we're also working with building management system companies, analytics providers, consultant engineers, pretty much right across the board of the building value chain. And just in terms of Plant Score, what it is and what we do, as Aaron said, we work on historical data, so we're slightly different than some of the central plant optimization platforms that you might have seen before, which come along with a black box. And we found when we were out there talking to people and trying to position our product at the black box, it means that there's not really clear lines of responsibility between the BMS provider and the central plant optimization provider. If something goes wrong, who's actually got ownership over the control strategy of the central plant and the operation of that HVAC system. And then the lack of transparency was another thing that we heard quite regularly. So rather than do that, what we've done is to open that process up and start with historical data as the main point that we use and build some optimization recommendations back from there, which can then be written into control logic by the incumbent BMS company. So that first step of the process is getting this historical data set, and ideally it's 12 months or more, so that we can train our algorithms to learn how efficiently different pieces of equipment in the central plant, chillers, pumps and cooling towers, will be operating given different conditions. So that's that next step there, the chill plant modeling. We've got a bunch of algorithms which take this data and then can calculate, as we'll see, COP as a function of say lift and part load of a chiller, and then are also looking at the pumps and the cooling towers which serve those chillers to really get a central plant model to be able to represent what's happening in the plant currently with mathematically. So we'll bring all that together into a single central plant model. And then once we've got that model, we'll run an optimization loop. And this is where we generate the optimized control strategy and simulate the energy savings. So that first step for us is to run an optimization loop and essentially feed that model with every cooling load and every outside air temperature that you could possibly imagine, and let that model go and run for a few days while it finds the best chiller staging, condensed water temperature set points, and load balancing opportunities within that plant for those given conditions. After a few days, we've got a whole lot of data that comes out, and we then simplify that down to what you'd see in a regular functional description for a plant, for a central plant. So that's things like chiller staging, condensed water temperature set points, and load balancing between the chillers themselves. That next step is then working with the incumbent BMS companies to implement the changes. So that's just writing control logic, and we can output the model in a whole lot of different ways, so that if we're staging based on chiller loading, if we're staging based on kilowatts of refrigeration output from the system, it doesn't make any difference for our model in terms of how it operates internally, but we can export those in ways that make that implementation quite easy. And finally, the measurement and verification. So being in Queensland, there's no bigs or ESCIs, unfortunately, available for this project, but there's still the value of the Australian carbon credit units is quite significant for a project like this, for the savings that we saw. So obviously it's more economic the further south you go. I think the VEG price at the moment is about $60 a tonne in Victoria. So pretty good savings potentials there. But it's enough about Exergenics. On to what we've done for Queensland Children's Hospital, and we'll run through this should be about 20 minutes. I'll try and run through it pretty quickly and leave a bit of time for questions at the end if there are any. But this is the system at Queensland Children's Hospital, and it's a centralised plant that's serving the precinct. So as Aaron mentioned, the 5 high load chillers are a bit over 3 megs each, and there's a low load chiller that's a touch over a megawatt of cooling capacity, and the chillers 1 and 2 have been decommissioned. So in this, we were just looking at chillers 3 to 8 in terms of how can we optimize this system. this first part of the plant score report, and we'll sort of jump into the plant score report and then jump out of excerpts and the graphs that sit behind some of the data that you'll see in here. But this just is providing the system information. So a very basic rundown of the main equipment in the plant. And then just to show you quickly what's happening behind the scenes there, because it all is sitting in a model and it's difficult to show. We've only got a couple of graphs of how the data comes into our model, but this is one that shows it quite nicely, and I might just pull this up so we can spin it around. Is that still showing up there? I'm not sure if that's come through, but someone can tell me if it's not showing up. But this is showing the COP of one of those high load chillers. I think this was chiller 6 in the system. It's showing the COP as a function of part load and lift. And for this project, unfortunately, we didn't have condenser water temperatures. Those trend logs weren't available, so we've used a pseudo lift here of outside wet bulb minus the leaving temperature set point. But you can see, so this was just to give us an idea of how the chillers are responding to a change in condenser water leaving temperature. But you can see here there's a pretty strong correlation even with that pseudo lift, and typically what we'd be doing is taking the condenser water leaving temperature and calculating lift from the BMS data itself. But here we've just replaced that with weather data so that we can have something that will train our model. So yeah, you can see that with these centrifugal chillers, the peak efficiency was around about 80%. 80%, and they start to drop off a little bit as you get to full load. So these are the kind of response surfaces that are then going into our larger optimization model, the global optimization model, that'll feed in and act as chillers within the model, so that then the pumps can be connected up and be serving those, as can the cooling towers. And once we've got those relationships in for all the pieces of equipment, we pretty much push run and don't tell the model what to do. We take our hands off and let those strategy recommendations come out. So jump back in here. Cool. So this is how we're presenting it as a plant score of 93 was the final result after we'd gone through that process of modeling each piece of equipment, building the simulation of the plant, running the optimization, and then comparing that to the existing strategy. We found that there was around about 7% efficiency potential improvement for that plant for the data that was provided, which I believe was 2019 or 2020. But we had a full 12 months of data here, so it was quite an accurate simulation of the potential efficiency gain in percentage terms. And as a bit of a breakdown of where that's coming from, the model spat out 3 recommendations in this case, and each of those has a energy and a peak demand associated with it in terms of the savings potential. So when we're running it through our simulation, it's shown that for example, updating chiller staging has a slightly under 3% potential efficiency improvement by taking that action. But all 3 of those recommendations together, the chiller staging, the dynamic condenser water temperature algorithm, and the chiller load balancing, finish up at about a 7% direct energy reduction and just over 5% peak demand potential reduction. So this one is a graph that has come out of the simulation, and this is on the x-axis here, the cooling load, the cooling load for the site, and then the average savings when we're comparing our optimized strategy compared with the existing control strategy. So it's not flat. There's different levels of savings at different cooling loads, and we can. Some of the graphs to come will show why that's the case, but you can see there's this definite hump around that 3,000 or 3 megawatts of cooling, 3 to 4 megawatts of cooling capacity, and there's a specific reason why that's the case, that there was a really good potential for savings here, and still decent potential for savings elsewhere. And in terms of what that looks like, this is cooling load on the on the x-axis here again, and we've got the central plant COPs. So we've compared here what's the current, and sorry, these aren't labeled. What's the current average COP for each cooling load is this orange line here. And you can see here the blue line is the optimized, or the model's idea of what the highest possible COP would be for those given cooling loads. And that difference there, shows up as the potential for improvement. And then just to touch on the financial results, we always assume, without knowing the energy costs of our customers, that we're always assuming 15 cents a kilowatt hour and $100 per kVA per year for that peak demand cost. And then we estimate the potential annual cost savings. So in this case, direct energy was the majority of the savings, with almost $65,000 and about a $10,000 a year kVA reduction, so a total of $75,000. And clearly hospitals pay considerably less than this, and I know some don't pay any peak demand charges at all, and perhaps that's closer to 6 or 7 cents per kilowatt hour, but it's still quite significant cost reductions given the cost of implementation of this kind of strategy is typically somewhere between $5,000 and $15,000. You're getting some really good paybacks there. And then in terms of the environmental benefits, this obviously assumes again that the hospital is connected to the grid and using that grid emissions intensity of about 0.8 of a kilogram per kilowatt hour. But if we make those assumptions, the 350 tonnes potential for abatement each year without any capital works. It's just updating the control strategy and doing that fine tuning and finding the savings that are already there. So a pretty good result in terms of potential abatement. Okay, now on to the actual staging and some of the recommendations of the report. So this is what a typical staging strategy would look like. And you can see we've got stage up and down demand set points, and then which chillers should be enabled or disabled in each stage. So as you'd expect, the low load is operating at low loads, and then we jump into a high load chiller. The biggest difference actually between our strategy and what was currently operating is bringing back on this low load in stage 3 rather than jumping straight to 2 high load chillers. And we can go into a few reasons why, but that's what causes that hump of savings at around the 3 megawatts of cooling range, is to bring this low load chiller back on. And actually the model liked the low load chiller so much that it tried to continually bring it back on for the entirety, which I can show you on this next slide. So here's the COP, the optimal COP for the plant at any one time. You can see here, this is the low load chiller is operating by itself, then the high load chiller comes on. This is the low and high. So that's that stage 3 in this region here, between about 3,000 and 4,000 kilowatts or 3 and 4 megs of cooling. And then you can see here, as this would be the 2 high load chillers, it's tried to bring the low load back on there. But we actually went through, so all of these strategies, after they're popped out from the model, we will go and review and look at things like chiller runtime. And if this was the case, the runtime of that low load chiller would actually start to take off and really outpace the high load chillers. And then you've got all sorts of problems with replacing one bit of plant before everything else is ready to be replaced. So given that it was only a really small difference in COP, a small difference in COP, and it turned out to be, I think, less than 0.5% potential energy savings. It was judged that rather than do that, let's just run the high loads at high loads and not bring this low load back on again. And in terms of what that looks like practically, this was a day, when was this? It looks like 16th of March in American, in the American style down the bottom there. So the 15th to the 18th of March, but this is with the current strategy. And you can see here that cooling loads in that region of between, often between 3,000 and 4,000. So this was a pretty good couple of days that would highlight where some of the major energy savings were coming from. And we're changing between 1 and 2 of these high load chillers on these days, which is exactly how the existing strategy was set up to run. But the way our optimized strategy has come out, we would be just running one of those high load chillers, the lead high load chiller, and then bringing the low load on at certain times of day to bring in to cover the rest of that cooling load, rather than staging the additional high load chiller on. And yeah, a reasonable amount of the energy savings were derived in this region. The next recommendation that came out was the dynamic condenser water temperature algorithm, and this probably looks like gibberish seeing it, but there's a graph next which shows it pretty well. But really what we're trying to do here is, rather than going wet bulb plus X and having a constant approach, we're using a dynamic approach. So we're letting the model decide, for a given cooling load, I know that my chiller has to produce, or my chiller or chillers must produce this much cooling. Then working back from there, what's the difference in COP depending on that lift across the chiller, and is it worth me running my fans harder to extract more efficiency from the chiller, or should I ramp down those fans? So this is what comes out. We get results for every, I think in this case it was 25 kilowatt jumps, but then we simplify that down. So it's a strategy that looks like this, that can be easily integrated into the BMS. So this would just be the condenser temperature set point is wet bulb plus 13 minus something multiplied by the kilowatts of refrigeration or the cooling load at that time. And what this looks like in practice is like this. So this is on your, again, on the x-axis is cooling load, and on the y-axis here we've got wet bulb plus X is what this turns out to be. So you can see, rather than starting at very, very low condenser water temperatures and trying to extract more efficiency out of a chiller that's not doing that much work, the models suggested that it's more efficient to float that condensed water temperature higher and then bring it down as the chillers increase in load, and it's worthwhile running those fans to extract that additional efficiency from the chillers. The last recommendation in this case was the load balancing, and this is just an excerpt from the report that explains what we're trying to achieve with load balancing, and really to summarize what's on this slide, the load balancing is when we've got 2 differently sized chillers running simultaneously. So this would be in stage 3 with that low load and high load chiller both running. And in this case, what the model comes out with is it suggests that we should restrict or demand limit one of these 2 chillers so that each of them is operating within their optimal part of that part load efficiency curve. And what that looks like practically is this here. So this covers all of stage 3, and on that low load chiller, we apply a demand limit. We apply a demand limit based on that total refrigeration through the system. And what this is trying to achieve is to say, given a certain cooling load, we should only use, for example, 72.8% of the, or we should limit the low load chiller to 72.8%, so that the high load chiller is doing some percentage of the cooling that is keeping both of them at their optimal point in the part load curve. And this is, rather than trying to optimize for a single chiller, this is just looking at plant COP as a whole, and then judging how much of the load each of the chillers should be doing. And obviously, depending on the HLI and the capabilities of the chiller and the controls, maybe only 4 of these can be implemented, and it's a bit more simplistic. But yeah, there are. And then on the other end of the spectrum, controls that can have CSVs dumped into them and lookup tables, pretty much straight like this. And I think that's it for me. So happy to stop sharing there, and I'm not sure what the time is, but take any questions if there are any.
Thank you very much, Iain. Yes, please leave your questions onto the chat function, or you can start a video and we can have a chat. Now, maybe people are not preparing questions, so maybe let me start with one or two questions, please, Iain. Maybe my first question is, did you find anything that is really surprising, or anything that is you didn't expect for our QCH Exergenics technology implementation or testing?
It was surprising to me that the low load chiller, the model wanted to keep the low load chiller coming back on and on at every stage, and we actually had to restrict it. That to me, because obviously the designers come in there with the thought that, okay, we'll use this for low loads and high loads, and there's that nice delineation there. So that to me was quite surprising that it was that efficient, that it wanted to keep coming back on and on. And we had to actually go in there and put a constraint on the model to stop it, so that those run times wouldn't get too out of whack.
Yep, thank you. We have one question coming from Mr. Schutz. That's thanks, Iain. Are you taking into account pumping energy when deciding to run multiple chillers at part load?
Yes, yeah, we are. So sorry, I should have mentioned that, but the pump energy is included. So that's essentially an energy penalty. Those primary pumps which are serving the chiller, you're paying an energy penalty for bringing on those additional pumps. But it's if that balance can really, we're very hands off with the model. So the condensed water and chilled water primary pumps which are serving that chiller are a part of it, and there'll be the energy associated with them. But then we don't really tell the model what to do. We let the model decide, okay, which chiller will I need to run to get the best possible plant COP for these given conditions.
Yep, thank you. Next is Tim has a question. What was the time frame for this project? If my memory is correct, that the real data we used was from May 2019 to April 2020. So we had like 3 or 4 months of COVID special month periods.
Yeah, and I think that data set, the good thing about that is because it was a relatively new BMS that was sitting there and ready to be accessed on the BMS. And then I think we got the final data set in March, early March, or maybe late February.
Yep.
And then, yeah, we were ready to go within about a month of there. And then now we're sort of talking about next steps and implementation actually of the writing of that control logic and the start of that. We've got the baselining data and now the start of that measurement verification period.
Yep. I have another question that, if you allow me to ask, that do we need to regularly update our model? Because, for example, I'm thinking hospital may have a change of, say, operation patterns, number of patients coming, or seasonal change, or maybe some parts of the building is retrofitted. That may happen, you know. So the building characteristics may change. I understand that you use machine learning or artificial intelligence to build the model, digital twin. Then, because the change of the operation, environment, or buildings characteristics, do we need to regularly update or have kind of a quarterly or yearly follow-up?
It's a good question. I think there's the value in that for certain buildings, definitely. I also see the value for some of our clients just wanting to do a quick one and done. And you know, they've got a short payback option. They know where they can go and look for these short payback opportunities. I think particularly with COVID and changing building occupancy constantly, there's definite value in redoing this, because there's some of those other more nuanced parts of the operation as you say, seasonal lockout of chillers is something that we're working to develop into the model at the moment, and that's something that we can update once a quarter, just to be able to have a look at how is your cooling load profile changing over time, and then is it actually worth getting into stage 2 or 3, or should we jump in the summer months, jump straight to stage 2 and forget about that low load chiller. So as we go, there's more and more value in those sort of quarterly updates. And I should mention we're building out our API functionality at the moment so that we can ingest that data from analytics providers or BMS providers if they've got an API, an open API. And once we've got that real-time ability, it's going to be we're probably a couple of months from being ready to go on that one. But once we've got that ability to pull in real time, one of the other interesting ones for this project was that chiller 4, one of those 5 high load chillers, had an issue. I think it was an air leak, and we picked that up in the data when the model had all those 5 chillers, and 4 of them were essentially identical in terms of their part loads and their efficiencies, and then there was a real outlier there. So the value in doing that in real time and being able to detect if something's gone wrong with the chiller, if the efficiency is not where it should be, that almost real-time activation is sort of the next step for us, and we'll be out by the end of the year.
Nice. Yeah. Thank you. So looks like we haven't got other questions from our participants yet. Because maybe from my own work, I'm the project manager for our IHUB Queensland Children's Hospital Living Lab, and also I'm involved with aged care providers as well, and sector-wide analysis and activities. I was wondering, because that's our Exergenics technology is quite a low risk. For example, there's no site access required and it's data-driven. But still, do you see any risks or anything that may impact or for our healthcare sector implementation?
I think that's one of the things we've tried to be very hard on, is that, so for example, some of these central plant optimizers will do a chilled water temperature reset, for example, and if you reset up to 8 degrees instead of 6, you're going to save a lot of energy in the central plant, and you're going to use a fair bit more on the air side with the AHUs. We've tried to be very careful around building not changing anything in terms of service delivery. So I don't see a whole lot of risk on that side. We're really just trying to deliver that chilled water throughout the building using less energy. So yeah, in terms of risk, the other one is our strategies, because the nature of part load efficiencies of chillers. The strategies tend to operate these chillers at part load more than at full load, more often than not. Which means that there's actually less stress and strain. So typically we haven't got the data because we haven't been around long enough yet, but I'd expect to see that maintenance costs decrease because of less stress on these chillers.
Yep, thank you. Thank you. Here we have a comment from Michael. Thanks for the presentation. Michael is from University of Wollongong, working on the IHUB Living Labs at Warrego Aged Care and 2 schools in ACT, and very interested to chat more. And so that maybe after the presentation, I'm not sure, Michael. Yeah, I'm not sure if I have Michael's email address or contact numbers. Maybe we can have some more chat after this.
We'll definitely reach out. Thanks, Michael.
Yeah. Okay, good.
Could I just ask a question directly, Ian?
Yep.
Yeah, I'm just really interested in your presentation. Thanks. And I guess our Living Lab was a bit different with schools in Canberra. It's much more heating dominated and gas dominant. And just interested, do your models and algorithms work with gas or conversion to reverse cycle?
No, unfortunately we don't do heating at the moment. We're looking into heat pumps and the potential for optimization there. Yeah, but nothing for gas at the moment, just because there's not that as big of an opportunity. We're really looking for, because it takes us typically like a good 6 months to a year to develop a model. The opportunity, once it is repeatable, the opportunity is pretty good building to building. But at the moment, I don't think the economics quite stack up for gas. Heat pumps, as they become more prevalent, though, is definitely an opportunity for optimization.
Sure. Yeah. No, I think there's some good opportunities to have a chat. So, yeah, keen to tee that up some stage, if that's all right. Yeah.
That'd be great.
Thanks.
Thank you, Michael. If we have no more questions or comments, maybe thank you very much, Iain, and we look forward to have more fruitful more outcomes and for the environment and the energy and the whole society. Thank you, Iain, for the great work.
Thank you, Aaron, as well, for all the support, and thanks everyone for sitting through that presentation.
Yeah, wonderful. Yeah, have a great day. Yeah.